Hello, welcome to this lecture on the cardiac output. It's a continuation of the series on the cardiovascular system, physiology of the cardiovascular system. And today, our focus is on the cardiac output. What is cardiac output? So, cardiac output is simply the volume of blood that is pumped by each ventricle per minute. That is cardiac output, which is given by the formula cardiac output is heart rate times stroke volume, with heart rate being the number of beats per minute and stroke volume the amount of blood that is ejected per beat, which is normally roughly around 70 mils each stroke per beat. So that is stroke volume. So cardiac output is simply a function of heart rate and stroke volume. Any factors affecting heart rate has an effect on the cardiac output. Any factors affecting stroke volume will have an effect on cardiac output. Yeah. It is primarily determined by four main factors. That is the preload, the afterload, the contractility, and the heart rate. These are the main four factors that are affecting cardiac output. Now let's look at preload and after. What is preload and what is afterload? So preload is simply the volume of blood in the ventricles at the end of diastole. So end diastolic pressure at the end of diastole. That is the preload. In other words, it is the stretch of the ventricles as it fills with blood. That is what preload. The stretch of the ventricles as it fills with blood. So it increases in what? Hypervolemia, regurgitation of the cardiac valves, and in heart failure it increases. Why? Because there's overload of fluid or blood in the ventricles. That is why preload increases in hypervolemia. When the blood volume increases, it means there's more blood that is going to fill up the ventricles. In regurgitation of the cardiac valves, it means that the valves are incompetent and they cannot close enough to prevent excess filling, or so because of that, there's the blood volume tends to accumulate, because even when they try to eject the blood out, not all the blood goes out with each beat. Some of it remains because the valves are incompetent. So it flows back. Then there's also heart failure. In heart failure, because of fluid overload, there's not necessarily fluid overload, because there's excess fluid, there tends to be increased blood volume, which goes to fill up the ventricles, 1 and 2, which is the biggest reason why is because now the heart cannot pump, cannot forcefully pump enough blood out of the ventricles. So because of that, even when they pump, the blood that comes out is not enough. So most of it, or some of it, or a certain amount of it remains in the ventricles. Then coupled with the one that is filling up, it increases the preload. That is, and because of that, increasing the preload decreases the amount of blood that gets ejected out. So if the blood that gets ejected out is reduced in conditions like heart failure, it means the cardiac output does what? Reduces. But if the blood volume is in like in hypervolemia where you have increased volume in blood, you have an increased volume of blood that is filling up the ventricles. So if the ventricles are filling up with blood, with too much blood, it means that if the ventricular walls are competent enough, they're going to contract and eject a lot of blood. So meaning this may increase the cardiac output. So as long as the ventricles are competent enough and following according to the Frank-Starling laws, the force of contraction is going to increase as these are going to stretch, and with increase in force of contraction, meaning more ejection will be or more blood will be ejected out, and with more blood ejecting out, meaning the cardiac output, that's what increases. That is the preload. In afterload is simply the resistance that the ventricles must overcome in order to effectively eject blood out. The resistance that the ventricles must overcome to eject blood out. And in clinical practice, we mainly refer to afterload as in relation to the left ventricles. The force or the resistance that the blood must pump in order to effectively circulate the blood. So it tends to increase in hypertension as well as the vasoconstriction. So if the aorta and other systemic arteries are constricted, or in the cases of hypertension, because in hypertension, usually, or in most of the cases, the vessels are constricted, the lumen is reduced. So because of that, there tends to be an increase in aortic pressure there compared to the ventricular pressure. So because of that, there's an increase, meaning the afterload is increased. So the ventricles must work hard enough. It must increase its cardiac workload. So the workload is increased, and because of that, there's an an effect on how much effective volume will come out of the ventricles as they contract. So meaning there's going to be a reduction in the effective ejected load of blood. So meaning that reduces the cardiac output. So a decrease in the cardiac, an increase in the afterload increases the cardiac workload, which reduces the cardiac output. Yeah, you decrease the afterload, you increase the cardiac output. So that is on preload and the afterload. Again, preload depends on the venous return. If there's an increase in venous return, there's going to be an increase in the preload. Increasing in preload with competent ventricular walls, there's going to be an increase in cardiac output. Increase in ventricular preload due to an increase in venous return with incompetent ventricular walls, there's going to be a reduced cardiac output. Why? Because the walls are not strong enough to eject the entire blood that is filling up the ventricular walls. Afterload is just the resistance that must be overcome in order for the heart to pump blood enough to circulate the entire body. That is the preload and the afterload. So which is just the same thing here. So feeding preload is simply the stretch of the heart that occurs with ventricular feeding. So things that may increase the preload, increase in blood volume, which is hypervolume medications like dopamine, and there's a slower heart rate. A slower heart rate means that the heart has enough time to fill with enough blood. So if the heart rate is enough, it means the contraction rates are reduced, which gives the heart enough time to fill up with the blood, which increases the preload. Things that may decrease the preload, a decrease in blood volume, a faster heart rate meaning it does not allow the blood to fill up with enough blood volume, hence decreases the amount of blood that gets pumped out. Then medications like furosemide decreases preload because they promote what? Diuresis. That is preload. Then afterload, it says the force of that the heart has to contract against to eject the blood. So here, what factors may increase the afterload? Stenosis of the aortic valve and hypertension. Yes, These increase the resistance that blood has to overcome, or that the ventricles must work against. That is afterload. Then other factors that may decrease the afterload: hypotension, vasodilation, medications like antihypertensives. These ones decreases the afterload because their aim is to reduce the degree of vasoconstriction or degree of stenosis. Yeah, that is preload and afterload. Then we also have contractility. So with contractility, mainly affected by the sympathetic stimulation, that is via the beta 1 receptors, which leads to an increase in calcium influx and hence increasing force of contraction, because remember that cardiac contraction depends on what the presence of calcium. So if you increase the presence of calcium, you promote the muscle contraction. You promote muscle contraction, you increase the contractility. So if you increase contractility, you increase the cardiac output. Catecholamines, digitalis, these are also work in a similar fashion to increase what? Contractility. Then this may be decreased in hypoxia, acidosis, as well as myocardial disease because they tend to affect the cardiac myocytes, hence reduced contractility. Heart rate, moderate increase in heart rate increases cardiac output. Why? Because there's more beats that occur in a minute. But excessive increase in heart rate to a point greater than 180 beats per minute decreases cardiac output because it decreases filling time. If the heart is going to be contracting very fast, meaning it will not have enough time for blood to fill the ventricles so that it can be pumped out. So it will be pumping out immaturely inadequate blood that fills the ventricles and hence decreases the cardiac output. But if the heart rate increases moderately, meaning it will just increase the amount of beats per minute, meaning it's going to increase the amount of blood that is being pumped out in circulation. And all these are regulated by the nervous system as well as there's hormonal control at play. So the nervous system via the sympathetic and parasympathetic systems. So the nervous sympathetic system increases the heart rate and the contractility. Parasympathetic decreases the heart rate and hence decreases the cardiac output. Hormonal control. So hormones such as the adrenaline, noradrenalines, these ones increase the cardiac output, and there are also other local factors such as the venous return, the muscle pump, as well as the respiratory pump. So the muscle pump, this is simply the activity of the gastrocnemius muscles. Then the respiratory pump is simply the ventilation, the changes that occur in the thoracic cavity, because an increase in thoracic cavity compresses on the vessels and acts as though it's a pump that tries to pump blood back to the heart. So it increases the venous return. So activity of these pumps also has an effect on venous return, which affects the cardiac output, because if you increase the venous return, you increase the cardiac output. If the venous return is reduced, even the cardiac output is reduced, because these are pumps that helps to bring blood from the peripheries, distant parts, and they are adding some degree of force to ensure that blood moves, or they add some pressure to ensure that blood moves in adequately and with enough pressure and force to go back to the heart. Yeah, so that is the regulation there. And that marks the end of this presentation on cardiac output. Thank you. See you next time.